So this is the exercise we use to re-establish the proper motion of the mechanical cogs between the pelvis, rib cage and skull. So the first thing we do is just to sort of settle in to a comfortable position. I like to do this lying down. If this is going to cause pain, do it seated or do it standing. The mechanics are the same. So find whatever position is comfortable. But if you can, do it lying down because it's easier to feel everything moving. So you're going to settle in, breathe comfortably through your nose. Your jaw should be relaxed, throat should be open, so it shouldn't be closed or overextended. Your eyes should be on the horizon, and just maybe take a minute to settle into this position, get rid of any residual tension, so you can pause, and once you've relaxed, press play again. Now what we're going to do is we're going to place one hand on the belly, one hand on the ribs. What we want is for the belly to expand and the ribs to remain relatively motionless. Any movement of the ribs is more of a ripple of what's happening here. The very classic thing we see with people who are struggling with their breathing or have back pain is that all the breathing is up here, so it's like sorry, I'm a bit congested. It's all up here, so there isn't really any movement here, and they're keeping their tight abs looking good. And so we want to allow our breath to move down into the belly, and this is going to probably feel kind of weird and quite intuitive after years of maybe breathing into your chest and sucking your belly in. But this is what happens when we effectively contract the diaphragm smoothly and expand into the belly. Like you're gonna look a bit pregnant, or like you got a bit of a belly there. So what people struggle with is really directing the air down into here. One thing you can do is get a weight like a kettlebell. It's quite easy, and you're just thinking of pushing that weight away, just like that. You want a nice natural pause, and then you're just going to exhale through your nose. Okay, so again, take a minute or so to get used to that motion before we progress to the next bit. So the next bit is working more specifically with the mechanics. So again, we have this concept of mechanical cogs. The rib cage is one cog, the pelvis is another. So as one moves forward, it has a knock-on effect like this. So you can kind of visualize this. And again, I like to think of the pelvis almost like a bowl or a cup of tea, and you're spilling it forward. As you inhale, you're spilling forward down towards your toes, and as you exhale, it's coming back and then maybe spilling backwards a bit, though you won't get as much motion backwards. So think of the top of your pelvis here, this bone right around the top of your pocket. Put a finger there and put your thumb on your lower ribs, and these 2 points should move apart as you inhale, natural pause, and as you exhale, they should move together as the belly button draws in and the ribs kind of sink down. And focus on those ribs sinking down, particularly if you really struggle, if you're staying here, if your ribs are staying flared but you're drawing the belly button down and you're ending up with this kind of shape. You want it to be a relatively even caving in versus like a cliff. Yeah. So that's the next thing, just settling in to these kind of mechanics. Do that for a minute if you can. If you're struggling with that, if it's too much to coordinate, focus on just the basic breathing without the mechanics. Adding in the mechanics is the next step. The next step after that, if you've done the mechanics and you're used to that, is to incorporate the head. So the head maps the pelvis. As the pelvis spills forward, we tuck the chin. So we're not really thinking of lifting the head forward. You can kind of think of it as if you've got a hook here and that's being pulled away from you. It's like it's decompressing your upper neck where your neck joins your skull, and you're flattening this arch. So when I'm resting here, I've got this arch there. As I inhale, I'm flattening that space, which effectively is a tilt forward of the skull, and then on the exhale we're getting a tilt back. This is very exaggerated, so don't worry about doing it to the same extent, but if you're comfortable with all that, maybe begin just with the pelvis and ribs. I find it easiest to focus on the pelvis. You might find it easiest to focus on the ribs. Find whatever works for you. And once you're comfortable with that rhythm, try and incorporate the head. So inhale, think either of flattening that space, or of tucking your chin while keeping contact here, or of having your head pulled away from your spine from the back. Whatever way you want to think about it, get that nice comfortable motion. We need to always keep contact here, and that's essentially it. Once you keep contact here and you tuck forward, you're going to get it, because if you just lift, you're losing contact. So that's your guide, keeping that contact. And again, this is why I like the floor, because we have the contact behind the pelvis, rib cage, and head. So once you're comfortable with that, we can progress to working with the glutes, and that's in the next video.